All right, I see about 20 of you on your cell phones right now, and I assume that you're publishing your academic papers on virology, since you guys are clearly all experts right now and want to take away federal oversight from our Health and Human Services Department. Now, I didn't get the years of training that apparently all of you guys did, so instead I tried to conduct my own research. I had my office reach out to the U.S. Department of Health and Human Services and the CDC. And HHS and CDC gave an extensive education on why they made their recent immunization changes. What stood out the most during the discussion, though, was simply the unmatched expertise and manpower that they bring to the table. The U.S. Department of Health and Human Services has around 62,000 employees, of which 12,000 are with the CDC, whereas the New Jersey Department of Health has only 5,000 employees, and we have nothing at all truly like the CDC. Now, not only that, but these federal bureaucrats at CDC and HHS are top-level experts, despite what you want to think. Most are globally renowned communicable disease experts or virologists. I'll give you some examples. Jeffrey Taubenberger, PhD, acting director of the National Institute of Allergy and Infectious Diseases. This dude is the guy that was the first to actually sequence the genome of the 1918 influenza pandemic virus. Bernard Moss, PhD, chief of laboratory and viral diseases at NIAID. His expertise is in pox viruses and viral pathogenesis. He developed vaccinia-based viral vectors used in vaccine technology. Julie Ledgerwood, she's the chief medical officer and chief of clinical trials program within NIAID. Her expertise is clinical vaccine trials, including Ebola, influenza, HIV, malaria, Zika, and other pathogens. At best, New Jersey has a tiny virology program in the public health and environmental laboratories, which, as far as I can tell, is primarily limited to testing. It would be absurd to not lean on our federal partners who are significantly better equipped than we are. Additionally, the federal government just completed the most comprehensive, expert-driven review of childhood immunizations in decades. This review was conducted by scientists at CDC, FDA, NIH, and CMS, the top public health and epidemiology experts on the planet. These experts concluded that the previous U.S. schedule was an international outlier. Far more shots in the U.S. for far more diseases than our peer nations across the globe. In 2024, U.S. children were receiving 84 to 88 doses for 17 different diseases plus RSV, which was more than any other nation in the world. Denmark, by comparison, vaccinates for only 10 diseases with only 30 doses and achieves extremely high uptake without any mandates. The CDC is still recommending that all children get vaccinated against diphtheria, tetanus, whooping cough, Hib, pneumococcal conjugate, polio, measles, mumps, rubella, and HPV, for which there is international consensus, as well as the chickenpox. But there are a litany of vaccines that were dropped recently, and for good reason. Here are just three. Hepatitis A was dropped. The U.S. incidence of hepatitis A last year, 1 per 100,000 people. Mortality for it is 1 per 10 million, mostly older men, not children. 0 deaths in New Jersey this past year. Rotavirus, pre-vaccine mortality in the U.S., 3.3 deaths per year among all children under 15. Post-vaccine mortality, 1.6 deaths per year. 0 deaths in New Jersey this past year. And look, if you'd like me to get off all the statistics that show how validated all that was, I'm more than happy to. But because the bottom line is simple. Your guys' Trump derangement syndrome is simply making you unable to accept anything positive that our president's administration does. This bill is attacking the federal experts, not because of science, but because you cannot accept that President Trump and RFK Jr. directed this review and that the science supports their positions. Don't let your own pride hurt the children of New Jersey. Thank you.